Good day. So, what is ergonomics? My name is Delene Sheesby, and in this video, I will be introducing you to ergonomics. So, what is ergonomics? Ergonomics means the scientific discipline concerned with the fundamental understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and methods to design in order to optimize human being or human well-being and overall system performance. That is what the Occupational Health and Safety Act tells us. Ergonomics is a vast subject. So in this video, I will only be covering defining ergonomics, risk factors inherent in the worker, risk factors inherent in the task, risk factors inherent in the environment, and controlling those risk factors. Let me explain further. Ergonomics is a way of designing workstations, work practices, and workflow to accommodate the capabilities of the workers. Ergonomic design reduces risk factors known to contribute to occupational ergonomic injuries and illnesses, such as sprains and strains and cumulative trauma disorders. In this video, we will refer to those as CTDs, cumulative trauma disorders. The increased rate and high cost of ergonomic injuries and illnesses such as carpal tunnel syndrome or tendinitis and musculoskeletal disorders, they cut across all industries and occupations. And unfortunately, some of the hardest hit are manufacturing, retail, and service industries. You'll probably notice that most, if not 30 to 50%, of your recordable injuries are somehow related to ergonomics. Musculoskeletal disorders can significantly increase costs of doing business, directly being medical costs and higher workmen's compensation premiums, and indirectly from increased employee turnover or absenteeism. Also productivity, product quality can indirectly be effective. Indirect costs could be 4 to 10 times higher than direct costs. An important strategy to solve the problem is to analyze that workstation design. Then you carry out task-specific and company-wide risk factor assessments. Training and education must be done. Then you develop and implement assistance for ergonomic programs to help prioritize ergonomic needs and/or answer to questions about current and possible regulatory requirements. Your practitioners can provide customized training for your specific workplace, and then, of course, all of that related to the ergonomic regulations. The ergonomic regulations were promulgated in December 2019, and without going too deeply into the regulations, we are immediately aware of the fact that, like all other regulations, the ergonomic regulations are a legislative requirement in South Africa. It is the employer's duty to identify and mitigate ergonomic risks and implement an ergonomic program. In this introduction to ergonomics, and in this video, I will deal with 3 risk factor areas. And those would be, first of all, the risk factors inherent in the worker, the risk factors inherent in the task, and risk factors inherent in the environment. People or workers, they come in all shapes and all sizes, and therefore each will have a unique attribute which presents to certain ergonomic risk factors to a given task or a job. Sometimes the task itself increases the likelihood of an injury. The environment within which the worker and task exists may also contain exposure to risk factors. We will start off by identifying who is at risk. A worker who is at risk of developing a musculoskeletal disorder may repeat the same motion throughout their workday. They may do their work in an awkward position or use a great deal of force to perform their jobs. They may repeatedly lift heavy objects or, unfortunately, face a combination of all of these risk factors. Musculoskeletal disorders include a group of conditions that involve the nerves, the tendons, muscles, and supporting structures such as the intervertebral discs. They represent a wide range of disorders which can differ in severity from mild periodic symptoms to severe chronic and debilitating conditions. For example, carpal tunnel syndrome. The median nerve is the power cable that supplies the thumb, the index finger, and the middle finger with all the movement signals as well as feelings to the skin. This includes touch, temperature, and a variety of other feelings. The nerve is the cable from the brain to the muscles. Pinching of the nerve can cause a disruption in the signal. A once-off pinch will cause symptoms for a short while, whereas continuous pinching will cause damage to the nerve, therefore resulting in longer-lasting symptoms. Tenosynovitis is the inflammation of the fluid-filled sheath. It's called the synovium, that surrounds a tendon, typically leading to joint pain, swelling, and stiffness. Tension neck. Tension neck syndrome is the neck pain and stiffness with tenderness of the trapezius muscle. Low back pain is caused by injury to a muscle or a strain to the muscle or ligament or a sprained ligament. Common causes include improper lifting, poor posture, lack of regular exercise, a fracture, a ruptured disc, or arthritis. Musculoskeletal disorders are often confused with ergonomics. Ergonomics is the science of fitting workplace conditions and job demands to the capabilities of workers. Musculoskeletal disorders are the problems and ergonomics are the solutions. So causes of musculoskeletal disorders can often be awkward postures, repetitive motions, forceful exertions, pressure points. Environmental factors can also cause ergonomic risks. For example, extreme high temperatures, causing the body to fatigue quickly. Hands and feet exposed to extreme cold can decrease blood flow, muscle strength, and manual dexterity. Then forcing excessive grip force applied to handles can also cause a musculoskeletal disorder. Lighting in the workplace, too dark, too light, may result in persons assuming awkward postures to accomplish work tasks as well as eye strain. WMSDs, these are work-related musculoskeletal disorders which arise from arm and hand movements such as bending, straightening, gripping, holding, twisting, clenching, and reaching. These common movements are not particularly harmful in the ordinary activities of daily life. What makes them hazardous in work situations is the continual repetition, often in a forceful manner, and most of all, the speed of the movements and the lack of time for recovery between them. So, what are these? What are the work-related musculoskeletal disorders? What are the symptoms? We have pain, numbness, tingling, reduced worker productivity, lost time from work, temporary or permanent disability even, the inability to perform the job task, and or an increase in the workers' compensation costs. People or workers come in all shapes and sizes, and therefore each will have a unique attribute which presents to certain ergonomic risk factors given to their particular job. Sometimes the task itself increases the likelihood of an injury. The environment within which the worker and task exists may also contain exposure to risk factors. Statistics tells us that musculoskeletal disorders affect 7% of the population, 14% of physician visits, 19% of hospital stays, 62% of persons with musculoskeletals report limitation of activity. So, ergonomics must focus on preventing musculoskeletal disorders, which are conditions affecting the muscles, the bones, the tendons, the ligaments, and other parts of the musculoskeletal system. By tailoring workstations and tools to match the user's physical capabilities and needs, ergonomic designs help reduce the risk of developing MSDs, such as carpal tunnel syndrome, back pain, or repetitive strain injuries. When ergonomic principles are applied effectively, individuals are less likely to experience discomfort and pain caused by poor posture or repetitive motions. As a result, they may require fewer visits to healthcare professionals for treatment of work-related musculoskeletal issues. Severe musculoskeletals can sometimes lead to hospitalization, especially when they result from accidents or chronic conditions. Ergonomics helps prevent the occurrence of such injuries in various settings, such as workplaces, homes, and healthcare facilities. By reducing the incidences of musculoskeletals, ergonomics contributes to fewer hospital stays and shorter recovery periods when injuries do occur. Musculoskeletal disorders can significantly limit an individual's ability to perform everyday activities, both at work and in personal life. Ergonomics can help individuals maintain their overall health and functionality by reducing the physical strain associated with the tasks. This in turn allows people to continue their regular activities with greater ease and comfort. Ergonomic improvements often involve relatively simple and cost-effective changes, such as adjusting chair height or using proper lifting techniques or providing ergonomic tools and accessories. These changes can have a substantial impact on reducing the risk of musculoskeletal disorders, making it a practical and accessible approach for individuals and organizations. Ergonomic risk factors play a crucial role in the well-being of workers, and understanding these factors is essential to prevent the development of cumulative trauma disorders, those CTDs. CTDs, also known as repetitive strain injuries, RSIs, or musculoskeletal disorders, result from the cumulative effect of repetitive tasks and poor ergonomic conditions. It's important to recognize that each worker's ability to respond to external factors is unique, which can influence their susceptibility to CTDs. Workers vary in terms of their physical capabilities, experience, and overall health. Some individuals may be more resilient to ergonomic risk factors than others. Factors such as age, fitness levels, and pre-existing health conditions which can impact on how a worker responds to external stresses. Workers with greater strength, flexibility, and endurance may be better equipped to handle repetitive tasks and maintain good ergonomic posture. Conversely, those with physical limitations or vulnerabilities may be at a higher risk. Adequate recovery time is crucial in preventing CTDs. Continuous exposure to ergonomic risk factors without sufficient breaks can lead to fatigue and strain. Workers need time to rest and recuperate to avoid cumulative damage to their musculoskeletal system. Recovery time factors include the duration and intensity of work, availability of breaks, and the nature of the tasks. Prolonged or monotonous work with limited breaks can increase the risk of CTD development. Over time, Prolonged exposure to ergonomic risk factors can lead to a reduced physical capacity in workers. This can manifest as decreased muscle strength, joint flexibility, and overall physical fitness. As physical capacity diminishes, workers may find it increasingly challenging to maintain proper ergonomic posture and perform tasks efficiently, further increasing the risk of CTDs. These CTDs are conditions that develop gradually due to repetitive motions, sustained postures, or forceful exertions. These can include conditions like carpal tunnel syndrome, tendinitis, and lower back pain. CTDs often result from a combination of individual factors, inadequate recovery time, and prolonged exposure to ergonomic risk factors. These disorders can cause significant pain, discomfort, and disability, affecting a worker's quality of life and productivity. The musculoskeletal system is made up of soft tissue and bones in the body. The bones are the load-bearing structure. The tissues that contract to create movement are the muscles. Tissues that connect muscle to bone would be tendons. Tissues that connect bones to bones are ligaments. Tissues that provide cushioning would be cartilages. And the communication system linking everything to the brain would be by means of the nerves, and the blood vessels are tubes that circulate nutrients throughout the body. It is important to understand that when designing a workstation or procedure, it should be designed for the specific individual working at that workstation. We are to consider the age, the gender, the physical activity, strength versus energy, anthropometry. We need to consider all of the above. One notable aspect of CTDs, cumulative trauma disorders, is that they tend to increase with age. Between the ages of 25 and 65, the prevalence of CTDs rise significantly. This can be attributed to several factors. Firstly, as people age, their bodies tend to accumulate wear and tear from years of repetitive tasks and movements in the workplace. Over time, these cumulative stresses on the musculoskeletal system can lead to development of CTDs. Secondly, loss of tissue strength with age is a contributing factor. Muscles, tendons, and ligaments tend to lose some of their elasticity and strength as individuals get older. This physiological change can make older workers more susceptible to soft tissue damage, increasing the likelihood of CTDs. Some studies show that neck and shoulder muscular pain is more common amongst females than males. More women than men are employed in hand-intensive jobs. However, some studies show that men are more likely than women to develop de Quervain's disease, which is more frequently use of hand tools. It occurs when the tendons that move your thumb become irritated or swollen. This condition is named after the Swiss surgeon Fritz de Quervain, who first described it in 1895. It's usually located at the base of the thumb on the side of the wrist. The pain may radiate up the forearm and worsen with the thumb and wrist movement, especially when gripping or pinching. Swelling can occur at the base of the thumb, and there may be a noticeable bump or nodule where the irritated tendons pass through the wrist. The area over the irritated tendons can be very tender to the touch. You may find it challenging to move your thumb or grasp objects. Activities that involve thumb and wrist motion, such as turning a key or opening a jar, can be particularly painful. You have this catching or snapping sensation. Some individuals with de Quervain's report a sensation of the thumb catching or snapping as they move it. To identify these symptoms, you can perform a simple test called Finkelstein's test. Try it. Make a fist with your thumb inside your fingers. Extend your arm forward. Bend your wrist towards your little finger, like an ulnar deviation. If this maneuver causes pain along the thumb side of your wrist, especially at the base of your thumb, it may be a sign of de Quervain. It's essential to consult a healthcare professional, such as an orthopedic doctor or a hand specialist, if you suspect you have de Quervain. They can perform a physical examination, review your medical history, and may order imaging tests like X-rays to rule out other conditions or get a better look at the affected area. Physical activity is a double-edged sword when it comes to workplace safety. On one hand, it can increase the risk of acute injuries, especially in physically demanding industries. But then on the other hand, a lack of physical activity can lead to weakened muscles and joints, increasing susceptibility to injury. Striking the right balance by promoting physical fitness and ensuring that workers are adequately conditioned for their job tasks is essential to minimizing these inherent risk factors in the workplace. Additionally, proper training, ergonomic considerations, and regular health assessments can contribute to a safer work environment and reduced risk of injuries and musculoskeletal disorders. The risk factors associated with strength in the workplace are primarily related to the mismatch between a worker's physical abilities and the demands of their job tasks. This mismatch can lead to increased injury rates, particularly in the form of musculoskeletal injuries. To mitigate these risks, it is essential for the employers to focus on ergonomics, provide training, and conduct regular assessments to ensure that tasks are appropriately matched to the strength of their workforce. This not only improves worker safety, but also enhances overall productivity and job satisfaction. Strength versus energy. Which is more important? Both strength and energy are essential for different aspects of work. Strength is critical for tasks that involve heavy lifting and resistance, while energy is vital for sustaining effort over time, especially in tasks requiring endurance and repetitive motions. To perform efficiently and minimize injury risk, individuals should balance their strength and endurance training to meet the specific demands of their work. Additionally, cardiovascular fitness plays a significant role in supporting energy levels and reducing the strain on the heart and lungs during heavy or prolonged work. The L5-S1 vertebrae are located at the base of the spine and play a crucial role in supporting the upper body and distributing forces and loads between the upper body and the lower spine. Several factors can increase the forces compressing the L5 and S1 vertebrae. To mitigate the forces compressing the L5 and S1 vertebrae, it is crucial to maintain a healthy weight, practice good posture, use proper lifting techniques, engage in regular exercise to strengthen the core and back muscles, and seek medical attention if experiencing chronic back pain or spinal conditions. Additionally, ergonomic adjustments in the workplace and daily life can help reduce the risk of excessive compression on these critical vertebrae. People come in all shapes and sizes, so designing for only the average person in a group causes problems for everyone else. Anthropometry is a critical tool for understanding the diversity in human body shapes and sizes. Designing for the average person can lead to problems for individuals who fall outside the average range, underscoring the importance of human-centered design principles. Additionally, anthropometric measurements play a role in assessing health risks, including the influence of obesity on the occurrence of certain musculoskeletal disorders like carpal tunnel syndrome. To create inclusive and effective designs, it's essential to consider the full spectrum of human variability and tailor solutions accordingly. The determination of work processes relating to task variables may increase or decrease the risks of CTDs and involves careful consideration of ergonomic design, the selection of tools and equipment, the choice of furniture, and the layout of the workspace. A proactive approach to ergonomics can significantly reduce the risk of CTDs and promote the well-being of employees. The layout of the workstation should encourage a neutral posture for employees. Ensure that tools, equipment, and furniture are arranged in a way that reduces excessive reaching, twisting, or bending. Providing adjustable chairs and desks allows employees to customize their workstations to their specific needs. This can reduce the risk of CTDs by promoting proper body alignment. The design of tools and equipment should consider ergonomics. For example, tools with padded handles and reduced vibration can lower the risk of CTDs in industries like construction or manufacturing. In tasks that involve heavy lifting or repetitive movements, using power-assisted tools or equipment can reduce the physical strain on workers. The weight and balance of tools can affect the strain on muscles and joints. Lighter tools with balanced designs are less likely to contribute to CTDs. Proper lighting is essential to prevent eye strain and maintain good posture. Inadequate lighting can lead to employees leaning forward or squinting, which can contribute to CTDs. Train employees on proper ergonomics and work techniques. This includes teaching them how to adjust furniture and equipment to their advantage and the importance of taking breaks. Tasks involving the use of force come with inherent risks, primarily related to musculoskeletal injuries, repetitive strain, ergonomic factors, and fatigue. Employers and organizations should prioritize worker safety by assessing and mitigating these risks through proper training, ergonomic design, and engineering controls. Reducing the force required in tasks can enhance productivity, reduce injuries, and improve the overall well-being of workers. The amount of force required for various tasks can indeed depend on a multitude of factors. The way you hold an object can significantly affect the force required. For example, a power grip, in other words, holding with the entire hand, generally requires less effort than a precision grip, holding with just the fingers or of the same object. The weight of an object is a fundamental factor. Heavier objects naturally require more force to lift, hold, or manipulate. This is often related to the concept of lifting mechanics, including factors like leverage. The size and shape of an object can also impact the force needed. Irregularly shaped objects may require more effort to maintain control and balance. Even your body posture plays a significant role. If you're in an ergonomically favorable position, you'll be able to exert more force more efficiently. Poor posture can lead to muscle fatigue and increased effort. Different activities demand varying degrees of force. For example, lifting a box from the ground requires more force than pushing it on a flat surface. The dynamic nature of the activity matters too. Lifting a moving object requires more effort than a stationary one. The friction between your hand and the object can either help or hinder your grip. A slippery object might require more force to hold, while a rough or textured surface can reduce the required effort. Extreme temperatures can affect your grip and muscle performance. Cold conditions may reduce dexterity and increase stiffness, while excessive heat can lead to sweating and a loss of grip. Tasks that involve pinching or squeezing require different types and levels of force. For instance, tightly pinching a small object requires more precision and may lead to localized muscle fatigue. Vibrations from tools or machinery can lead to muscle fatigue more quickly. Workers who use vibrating tools often experience increased effort due to the constant shaking of their hands and arms. The longer a task is performed, the more effort may be required due to muscle fatigue. Prolonged exertion can lead to muscle strain and decreased efficiency. Then, repetitive tasks can compound the effort required. Over time, even if each repetition doesn't demand much force individually, the cumulative effort or the cumulative effect can lead to muscle fatigue and strain. You are a lever. This statement is a simplification of the human body's biomechanics. When you lift an object, your body acts as a lever system, with the pivot point being the joints involved in the movement, such as the hips and the knees. When you lift a heavy object, the force required to lift it is distributed across your body, with a significant portion of it being borne by your lower back. The lever action amplifies the compressive forces on the spinal discs and supporting structure. That statement, lifting 25 kgs at a distance from your shoulder of 55 centimeters will result in 250 kgs of compressive forces on the lower back. That statement is based on the principles of torque and mechanical advantage. When you lift an object, the farther it is from the pivot point, in this case your lower back, the greater the force required. The 25 kg weight multiplied by 55 centimeter distance from the shoulder results in a torque of 13.75 kilogram to meter. This torque is then converted into compressive forces on the lower back. Compressive force on L5 S1 disc exceeding 250 kgs causes 4 times the injuries than forces of less than 250 kgs. This part of the statement emphasizes the critical importance of understanding the limits of the spine's load-bearing capacity. The L5 S1 disc is a specific region of the lower back that is particularly vulnerable to excessive compressive forces. When the compressive force on this disc exceeds 250 kgs, it greatly increases the risk of injury, such as herniated disc or other spinal injuries. The 4 times the injuries suggests that the likelihood of injury significantly increases when the threshold is crossed. In practical terms, this statement underscores the importance of proper lifting techniques, ergonomics, and the use of lifting aids when dealing with heavy objects. Lifting with your legs, maintaining a neutral spine, and distributing the load as evenly as possible are key strategies to reduce the risk of back injuries. Overall understanding the lever action involved in lifting and being aware of the potential compressive forces on the lower back can help individuals take precautions to protect their spinal health when performing lifting tasks. The greater the force required to do the work, the greater the degree of risk. Consider posture, velocity, repetition, and duration in conjunction with force. If we look at the symptoms and the possible ergonomic causes, if your feet or your legs ache and you have varicose veins, possibly you are standing in one place too long. If you have lower back pain, your trunk might be curved forward while standing or sitting. If you have pain in your shoulders and in your arms might be outstretched sideways, forward or upwards too long. Shoulders are forced up due to position of work. If you have neck pain, your head might be inclined too much backwards or forwards. Forearm pain is an unnatural grip, static grip which has been too forceful. If you have wrist pain, repetitive hand or finger motion. It's interesting to look at the 5 force-related conditions that may increase the risk of injury. In the top picture, there's a person typing on the keyboard, and you'll see that the person's hand and wrist are pressing against the table. This is contact trauma. It could be contact trauma, where part of your body presses against an external object. Sustained force may cause too much mechanical stress on the tissues. And in the picture below, grip. There's a right way and there's a wrong way to grip an object. There's the pinch grip, where fingers exert the force, and the power grip, where muscles of the entire hand applies force, which is much more or most effective and safest. Static exertion is when one is standing, sitting, or remaining in one position for a long duration while you perform a task, and that can increase the likelihood of injury. Static exertion combines force, posture, and duration to result in fatigue on muscles, acquiring eventually a CTD. Gloves. Wearing a thick gloves to accomplish intricate manipulation of small objects requires more grip or more force, and then eventually this increases the risk of injury. Wearing bulky clothes when performing a task requires the muscles to do extra work. That also increases the force. Segmental vibration refers to a type of vibration that occurs in distinct segments or sections of an object or structure rather than propagating uniformly throughout the entire object. This phenomenon often arises in complex mechanical systems such as machinery or vehicles and can have various causes and effects. Segmental vibration can occur when different parts of a structure or machine experience vibrations at different frequencies or amplitudes. These variations in vibration can lead to localized resonance or oscillations within specific segments of the system. This can be problematic because it can result in increased wear and tear, decreased efficiency, and potential structural damage. If a worker can't feel the grip properly, He or she may compensate by applying more force than is necessary to hold the handle of an object. Segmental vibration has also been linked to carpal tunnel syndrome. Whole body vibration involves the transmission of mechanical vibrations to a person's entire body and can have various applications, including exercise therapy and industrial use. Its effects on health and well-being can depend on factors like the frequency, amplitude, and duration of exposure. Whole body vibration usually results from two types of forces acting on the worker. There's instantaneous shock load, like a vehicle striking an object or an obstacle, or a sudden drop into a hole may produce these shock loads. If these shock loads are sufficiently great, the operator may be thrown from the seat or struck by objects flying around in the cab. The most common whole body vibration forces are not sudden, but rather occur over a period of time. For example, this type of vibration is usually created by large vehicles as they travel over highways and especially terrain. Repetition refers to the frequency at which certain body parts or muscles are subjected to repetitive movements or stress. These high-risk repetition rates can increase the likelihood of developing overuse injuries or musculoskeletal disorders. The risk varies depending on the body part involved and the nature of the repetitive activity. Repetitive tasks like typing, data entry, or assembly line work can strain the wrists and the hands. High repetition rates without adequate breaks and ergonomics can lead to conditions like carpal tunnel syndrome and tendinitis. Jobs that involve overhead lifting or frequent reaching can put the shoulders at risk. High repetition rates in these activities can contribute to conditions like rotator cuff injuries and shoulder impingements. Activities that involve repetitive bending and extending of the elbows, such as plumbing or painting, can lead to overuse injuries like tennis elbow or golfer's elbow. Jobs requiring repetitive lifting or bending at the waist can strain the lower back. High repetition rates without proper lifting techniques can result in lower back pain and/or herniated discs. Occupations that involve frequent kneeling or squatting, like construction work or gardening, can strain the knees. High repetition rates in these positions may lead to conditions such as knee osteoarthritis. Jobs involving prolonged periods of looking down at screens or paperwork can strain the neck. High repetition rates in poor neck posture may contribute to neck pain and musculoskeletal issues. Jobs that require standing for long hours or involve repetitive movements of the feet, such as walking or running on hard surfaces, can lead to foot and ankle problems. The measure of the length of time of exposure to a risk factor is a critical aspect of occupational health and safety. It plays a significant role in assessing and mitigating the potential health hazards and risks faced by workers in various industries. The duration of exposure to risk factors can vary widely and should be considered alongside other factors, including the worker's physical condition, posture, force exerted, weight lifted, environmental conditions, and stress levels. The measure of the rest period available for muscles to rejuvenate is a multifaceted concept involving oxygen replenishment, metabolite clearance, nutrient delivery, and psychological recovery. The duration and specifics of the rest period depends on individual goals and the type of exercise performed. Proper management of rests and recovery is essential for optimizing performance, preventing injury, and promoting long-term health and fitness. To reduce the risk of ergonomic-related issues, it's essential to maintain a neutral posture whenever possible, with the spine aligned and minimal twisting. Use tools and equipment that are ergonomically designed to reduce strain. Take regular breaks to stretch and change positions. Use proper lifting techniques to minimize strain on the back. Adjust workstations and equipment to fit the individual's body size and needs. Provide training and education on ergonomics to employees to promote safe work practices. By addressing awkward postures and promoting ergonomic principles, workplaces can enhance employee comfort, reduce the risk of injury, and improve overall productivity and well-being. Postures that increase the risk of injury can have significant implications for an individual's musculoskeletal health and overall well-being. Wrist flexion or extensions, especially during repetitive tasks, can increase the risk of developing conditions like carpal tunnel syndrome. These postures compress the median nerve, which can lead to symptoms such as pain, numbness, and tingling in the hand and fingers. Ulnar deviation of the wrist exceeding 20 degrees can lead to wrist pain and discomfort. It may also contribute to conditions like ulnar deviation, which affects the alignment of the wrist joints and can lead to chronic pain and reduced wrist function. Maintaining shoulder abduction, in other words, raising the arms away from the body, greater than 60 degrees for extended periods, especially for more than 1 hour a day, can increase the risk of acute neck and shoulder pain. This can lead to conditions like shoulder impingement syndrome and strain on the neck muscles. Working with the hands at or above shoulder level can result in an increased risk of tendinitis, rotator cuff injuries, and various shoulder disorders. The shoulder joints are placed under greater stress when arms are elevated, potentially leading to chronic pain and reduced range of motion. Prolonged and excessive flexion of the neck, such as when looking down at a screen for extended periods, known as text neck, can lead to potentially severe neck and shoulder pain. This can result in musculoskeletal strain and discomfort. Bending at the lower back while working, especially with poor posture and heavy lifting, increases the likelihood of low back disorders. This posture can strain the lumbar spine and supporting muscles, leading to acute or chronic back pain and a higher risk of herniated discs or other back-related conditions. There are rules to follow for sitting workstations. The angle between the upper arm and the forearm should be 70 to 135 degrees. The angle between the upper and lower leg should be 60 to 100 degrees. The angle between the torso and the thigh should be 90 to at least 100 degrees. And the feet should be placed flat on the floor. Similarly, there are rules for standing workstations. The work surface should be 5 to 10 centimeters below elbow height for precision work. The work surface should be 10 to 15 centimeters below elbow height if lifting light weights and working with bins, tools, and other materials. The work surface should be 15 to 40 centimeters below elbow height if lifting heavy weights. Twisting in the middle of a lift amplifies forces on the lower back. Twisting while lifting, pushing, pulling, lowering, or raising may expose the back to a much greater risk of a back injury. Heavy dynamic exertion typically involves tasks that require the use of force to move objects or materials that are heavy, bulky, or have an irregular shape. This force may be applied intermittently or continuously during the task. Heavy dynamic exertion is associated with several risk factors, including the weight of the object being handled, the frequency and duration of the exertion, the posture of the worker, and the presence of any awkward or non-neutral wrist, back, or body positions during the task. Prolonged or repetitive heavy dynamic exertion can lead to the development of musculoskeletal disorders such as strains, sprains, and overuse injuries. These can affect various parts of the body, including the back, shoulders, neck, and upper extremities. Numerous environmental risk factors occur, such as heat stress, heat exhaustion, heat cramps, dehydration, electrolyte imbalances, loss of physical mental work capacity can all result from heat stress, as well as cold stress. If the worker is exposed to an environment so cold that the body cannot maintain adequate deep core temperature, hypothermia can set in. Adequate general and local lighting must be provided for rooms, building, and work areas during the time of use. Also, noise. Noise is unwanted sound. It can be serious, temporary, or permanent deafness occurring, or tinnitus. Then there's psychosocials. Psychosocial demands may produce increased muscle tension and exacerbate task-related biomechanical strain. Psychosocial demands may affect awareness and reporting of musculoskeletal symptoms and or perceptions of their cause. Ergonomic improvements are changes made to improve the fit between a job and the capabilities of the employees performing it. Analyzing jobs to identify factors associated with risk for musculoskeletal disorders lays the groundwork for developing ways to reduce or eliminate ergonomic risk factors for musculoskeletal disorders. Ergonomic hazard control strategies are: number 1, elimination; number 2, substitution; 3, engineering controls; 4, administrative controls; and 5, personal protective equipment. Elimination and substitution, while most effective at reducing hazards, also tend to be the most difficult to implement in an existing process. If the process is still at the design or development stage, elimination and substitution of hazards may be inexpensive and simple to implement. Elimination involves removing unnecessary controls or steps from a process or system to simplify the task. It is a proactive approach to reduce complexity and streamline workflows. Substitution is the replacement of existing controls or equipment with alternatives that are more ergonomic or user-friendly. This often involves finding more suitable tools or methods for a task. Engineering controls involve making changes to workstations, tools, or equipment used on the job. These controls are preferred over all others because they make permanent changes that can totally eliminate hazards at the source. Although they may be more expensive to implement than other controls, their effects is often more significant. Administrative controls help manage and mitigate risks through policies and practices. Personal protective equipment provides a last line of defense, with other controls are not sufficient. An effective ergonomic program often combines these controls to create a comprehensive approach to workplace safety and employee well-being. And so, in conclusion, I would like to extend my heartfelt gratitude to all of you for investing your valuable time in this training session. I genuinely hope that the content in this video has equipped you with the fundamental knowledge of ergonomics, empowering you to kickstart an ergonomic program in your workplace. Remember, your well-being and that of your colleagues are of utmost importance. If you find yourselves interested in furthering your understanding of ergonomics, or if you're considering providing ergonomics training alongside other essential occupational health and safety programs for your staff, please do not hesitate to reach out to me. I'm here to support you in creating a safer, healthier and more comfortable work environment for everyone. Together we can make a positive impact on your workplace and the well-being of your team. Thank you once again, and I look forward to the opportunity of working with you in the future. Stay safe and ergonomically sound.